Good morning. It's your daily dose of complete health with your local chiropractor, Patrick Hogg. And I had another one of those days yesterday where I had a couple of new patients coming into the clinic, and I heard the following sentence once again, which is, "Oh my goodness, I finally feel like someone understands me," or "Oh my goodness, it's so nice to actually have someone listen to me," or "Oh my goodness, I feel like you actually understand my problem." And it's crazy because at the moment, how many people are getting frustrated with their health is unbelievable. Have you been getting really tired of the fact that it's almost impossible to get a consult with your GP? Has anybody found it really frustrating that even when you finally get a consultation with your GP, it's over the phone? And even if you manage to get that consultant with the GP over the phone, you end up getting referred or fobbed off to someone else to then go through the problems again. So one of the things that I'm seeing with a lot of my clients at the moment is they're explaining their history multiples of times because, one, they're not even being able to get a consultant on the phone, so they can't get their GP on the phone. And then when they finally do, they obviously explain it to the GP. The GP says, "Well, okay, so we're going to triage you to over here." You end up getting referred over to there. They'll end up doing an examination. They'll refer you to the radiographer. Then you end up with it. And the point is that this referral pattern goes on. And for some of my clients that I've been seeing, they've been being referred around for the last 6 months to a year, just trying to work out what their problem is. Now, the great thing about our team, and the reason why a lot of people use the sentence like, "I finally feel someone has listened to me," or "I finally feel like someone's understood the problem," "I finally feel like X has happened," is because not only does our team book you in as quickly as possible to try and get your problem solved as fast as we possibly can, we'll get you back to discuss the results of the examination as quickly as possible. Our team will do all of the examinations for you. They'll do all of the imaging for you if that's something that we do. We do all the reports for you. We do all the care planning and care setting. And we even go the extra mile in our clinic so that we actually send out regular emails with tips on hints on exercises and diet and nutrition stuff that you can do. We have newsletters that we appear in the clinic every 2 months. We have a YouTube channel with loads of exercises on it, all linked back to this clinic. And we do this all for our patients. And just the fact of listening and sitting down and physically putting your hands on someone, being able to go, "Okay, this is where the problem is," and then being able to image it and show someone where the problem is, automatically helps that person to feel as if they understand their problem and feel a little bit better that we have the skills and the ability to actually help that person with that problem. So maybe you're going through that frustration circle at the moment where you've been referred around by a load of different doctors or GPs or consultants, and you're struggling with like a back pain or a headaches or a knee injury or an ankle injury or a shoulder injury that just doesn't seem to be getting better. You're struggling with some sort of health complications that just don't seem to be getting better. There are options. We obviously do free health screenings within the clinic. These are completely free of charge. We do these roughly every 6 weeks. So you can come and see whether we are the right fit for you. We're just starting to do health classes again. Again, all our health classes are completely free. We're just about to do our first sciatica and low back pain clinic, where we're going to be discussing some of the main causes of sciatica and low back pain. That's going to be starting next week. And so we're going to have loads of facilities and tools where people can come and learn how to take care of their body a little bit better, so that they actually feel like someone finally understands, and so that they can understand what's going on, and so they can actually empower themselves to take control of their problem. Because that's what it's all about. Healthcare shouldn't necessarily become this incessant need for constant reuptake of the same drugs, rehabilitation, etc. So we want to be looking at ways that we can help the patient to sustain their problems long term. This is Patrick here from Complete Health. This is your daily dose. I'll speak to you again tomorrow. Take care for now.